I want to touch base upon women and bone health.
Okay.
Okay. So we really wanted to know more about
I've heard most of your viewers are women.
women. You know why?
Because you're so handsome.
That is absolutely not the reason. Because many are they are finding it difficult to lose weight because of the hormonal imbalance. Estrogen, progesterone, we men are actually lucky
Yes,
that we only have testosterone.
There is no menopause.
There's no
as such.
menopause. There is no, every month menstrual period doing with, estrogen phase, follicular phase, luteal phase, nothing. The reason that I feel that my time restricted feeding method, intermittent fasting works for women mainly is because they feel benefit much earlier than men because of their disordered hormonal imbalance already.
Okay.
So what I see commonly is that when they are hitting menopause around like 45, the first thing they are worried about is this bone health. What happens during menopause? What is the association between estrogen and bone health?
Definitely, sir. That is, it's common. I mean, it's like, it is otherwise called perimenopausal osteoporosis. Osteoporosis is a very common term nowadays. Most of us know what it is. Osteo means bone. Porosis means the density of the bone becomes less. The density of the bone becomes less around the menopausal period. That is why it is called perimenopausal or postmenopausal osteoporosis. Estrogen, as we know, has this reproductive function.
Correct.
But other than the reproductive function, it has one more very important function, which is strengthening of the bones. So the bone has two types of cells. One is called an osteoblast, the other is called osteoclast. The osteoblast is the bone building. Osteoclast is the bone removing. So estrogen has effects on both these cells. It inhibits the osteoclast, which means prevents removal of the bone, additional removal, and it helps in the addition of the bone.
Explain more why a bone should be removed.
So there is bone turnover, sir. That is just like any other organ, the bone is also, whatever skeleton we have today is not the skeleton we'll have 6 months later. So some of the cells die, some of the cells are added, isn't it? Just like it's called turnover. So this turnover is
Like a balance.
Where some of the bone is added, some of the bone is removed. So when removal is more than what is added, they develop osteoporosis. So this estrogen has this inhibitory effect on the removal. It prevents removal. So it acts on that level and therefore it prevents loss of bone. But when the estrogen is gone following menopause, the removal happens at a much accelerated rate. The formation happens little slower. So that is why osteoporosis happens around menopausal time period. Especially so if the patient is already having obesity or if the patient has steroid intakes, etc.
In your patient population, do you think men or women, which group has more osteoporosis?
Definitely women. Definitely women. As you say, because of the fact that men don't have a classical andropause. So it is a prolonged andropause like 55 to 66 or 60 to 70. But women have a classical menopause. Just like 2 or 3 months, the period stops, the estrogen stops functioning. So because of this sudden stop of reproductive function and estrogen production, definitely women are the ones who are more prone for osteoporosis when compared to men.
Okay.
One more reason, testosterone itself by its nature is much more osteoblastic and it provides more impetus for good bone strength when compared to estrogen.
Osteoblast is formation of bones.
Formation of bones.
Formation of bones. Nice. So in osteoporosis, let's say a woman is reaching a menopausal stage. When should be concerned that she has osteoporosis, or everybody who's reaching menopause should get a preventive DEXA scan to analyze?
Ideally, yes, sir. Maybe 45 plus. 45 plus. Most of the women, there is no direct rule that everybody has to undergo the DEXA scan, but it is ideal that women after 45 years of age, maybe once a year or once in 2 years, they need to do the DEXA scan, make sure that their osteoporosis make sure that their bone density levels are normal. In case there is some difference, it is called, the beginning stage is called osteopenia. So when it is just at the stage of osteopenia, it is easier to correct, prevent it from becoming classical severe osteoporosis. It is better or ideal for women after 45 to do probably an annual DEXA scan to rule out early osteoporosis and correct it before it becomes severe.
Yeah. One important thing that you're listening to this, if a person who listening to this podcast, if you're more than 45 plus, my recommendation is to get a DEXA scan as soon as possible to analyze the body fat percentage that you have, because I did.
My recommendation too.
Yes, orthopedic as well. Because when I did the DEXA scan, I did for my body fat percentage distribution.
yes,
okay. It is 2,500 rupees in Chennai.
Okay.
On an average. In the US, it's $100,
Which is about
around 8,000 rupees.
okay.
Okay, but we use coupon because we US people are very good in coupons. So if you're a person who is listening to this podcast from the US, you go to Groupon, there will be like 20 to 30% discount. $40 to $50 will be the scan.